Hello everyone. Today in the series of Docplexus Scale interviews, we have a very special guest, Dr. Bansi Saboo, who is a Chief Diabetologist and Chairman of Diabetes Care and Hormone Clinic at Ahmedabad. Dr. Bansi Saboo is the Organizing Chairman of RSSDI 2018. Thank you so much, Doctor, for the interview. So to begin with the first question, can you brief us about therapeutic inertia in type 2 diabetes?
See, therapeutic inertia in type 2 diabetes is very common because the uptitration of the treatment, most of the diabetic patients are at present in India, 2/3 of them are not achieving a good control. And one of the important reasons for them is that rightly the titration of the dose is not done. So uptitration dose is not done by primary care physician, and that is one of the important reasons that we have so much therapy inertia and we have many patients with uncontrolled diabetes.
Okay, so moving on to the next one, in your opinion, what is the prevalence factor of therapeutic inertia in patients?
See, to be very frank, we can't have the exact data as a prevalence factor because you may have 100,000 patients, but out of them, how many of them are not achieving control? There are multiple factors. It's a physician factor, it's a patient factor, it's a system factor. So many of the patients are not coming you regularly, many of the patients are not compliant, and many of the times doctor is not uptitrated the dose also. So there are multiple reasons for a clinical inertia or not achieving the targets. But we have a very interesting data which was done in NHS in UK population where more than 80,000 of the patients were, the data survey was done, and this review had shown that almost 2/3 of them were not controlled. And a similar situation we also have done in some of the cross-sectional data from India and many parts of the world.
Okay, all right. So doctor, do you feel it's time to overcome multifactorial therapeutic inertia?
Yes, it's a time to overcome multifactorial therapeutic inertia. It's very, very important as we have the data, like with the steno 2 where multifactorial intervention had improved the quality of the life and quantity of life. In the similar way, if we will keeping this uncontrolled diabetes, what we are going to have, we will have prematurely, people will be developing more and more diabetes complication. And more than that, it will create a more of a morbidity. One may have a good number of years to live, but with more morbidity. So quality of life is very, very important. So it's a time that we give, this therapeutic inertia from a physician perspective has to go down, and we have to improve the quality of care for our diabetic patients.
True, true. So doctor, lastly, what can be the major benefits after overcoming therapeutic inertia?
If we could get, the benefit will be huge. This year also the RSSDI, and the next year, 2 years, we are trying that how we can improve the therapeutic clinical inertia with the primary care physician. Okay. And can we get more and more patients with achieving glycated hemoglobin near to the target HbA1c? And this will definitely improve not only the quality of the life, it will delay the complication. Now, why it is so important nowadays? Because we are getting diabetes in younger population. Now the diabetes is not in the 50s or 60s, it is in 30s and 40s. So if they will be keeping their diabetes uncontrolled, they will develop complication at the age of 50 or 55, which will be a major problem. Rather than for few years, they were developing diabetes in 50s, getting complications 65, 75, which is more acceptable by society, but now it can't be accepted. So by all means, we have to improve the care of diabetic patients. We have to increase the knowledge about the care of the diabetic patients, and therapeutic inertia has to go down in the physician community.
Right. So doctor, you're the organizing chairman of RSSDI this year. So how has been your experience?
So there is a RSSDI organizing chairman, and next year I am the scientific chairman for the Jaipur meeting. I will ask all the delegates and all the faculty members along with all the RSSDI members that we have to work very hard to improve the care for diabetic patients. It's just not the 4 days CME of this RSSDI conference is sufficient. We are doing 20 more state CME. There are many more diabetes awareness programs, but I think we have to increase more and more. And I must congratulate Docplexus also for the same, that you are increasing the awareness by getting the bites from the doctor, and then this goes across the country.
Sure.
With this, thank you very much.
Yeah, thank you so much. It was a pleasure having you here.
Thank you.
Thanks a lot.